The easiest way to characterize harmonics produced during reflection and requiring the utilization of microbubbles is A. Tissue harmonics. B. Fundamental harmonics. C. Contrast harmonics. Which color Doppler program precisely takes color out of a flow that flows slowly? A. Decreasing PRF. B. Wall filter. C. Increasing PRF. D. Color gain. Which parameter is most related to cavitation tissue? A. Energy. B. Pressure. C. Duty factor. D. Pulse repetition frequency. Which phantom from the list below does sonographic quality assurance? A. Tissue equivalent phantom. B. Constancy test phantom. C. Sensitometry wedge phantom. D. Axis alignment phantom. As the frame rate goes up, resolution goes up. A. Spatial. B. Elevational. C. Lateral. D. Temporal. A pulse sound wave is best described by the following acoustic parameter. A. Duty factor. B. Period. C. Propagation speed. D. Frequency. Active elements in 3D transducers are arranged in a particular pattern, or A. Straight. B. Checkerboard. C. Arched. D. Backgammon. The sonographer increased output power by changing system settings. Which of the subsequent takes place? A. Voltage decreases. B. Penetration decreases. C. Overall gain increases. D. The displayed image darkens. What happens to the visual display when a mechanical transducer's PZT crystal is damaged? A. Loss of entire image. B. Inconsistent beam steering and focusing. C. Horizontal band of dropout. D. Vertical band of dropout. When depth is raised, which of the following happens? A. Frame shortens. B. Time of flight decreases. C. Frame rate decreases. D. Temporal resolution increases. Sonographers should be aware of work-related musculoskeletal disorders. The best practice while scanning is to avoid abducting the arm more than how many degrees? A. 50 degrees. B. 90 degrees. C. 30 degrees. Which action demonstrates best practice during ultrasound exams regarding the Alera principle? A. The exposure time should be extended during the exam. B. Use the lowest possible output power that provides a diagnostic image. C. Ensure that the gain compensation, TGC, is within acceptable limits. Which type of cavitation is the most concerning cause of bioeffects? A. Transient. B. Absorption. C. Stable. D. Thermal. Assuming an unfocused ultrasound beam. The American Institute of Ultrasound in Medicine's statement on mammalian biological effects of ultrasound in vivo has confirmed that no bioeffects have been noted when the spatial pulse temporal average (SPTA) intensity is less than which value? A. 1 mW cm2. B. 100 mW cm2. A sonographer notices that the mechanical index, MI, is too high during an ultrasound. What would be the most appropriate modification that the sonographer can make? A. Decrease receiver gain. B. Increase period. C. Decrease the output power. Select the technique that will generate the least amount of exposure to the patient. A. Spectral Doppler. B. Color flow Doppler. C. Grayscale. D. M mode. When a vibrating string or fluid pump is used to test system performance, what parameter is being tested? A. Dead zone. B. Doppler velocities. C. Contrast resolution. D. Grayscale sensitivity. Which parameter would change on a phantom test if the spatial pulse length were made longer? A. Axial resolution. B. Lateral resolution. C. Horizontal distance resignation. D. Sensitivity. The speed of the ultrasound in soft tissue is closest to A. 1.540 km SEC. B. 1.54 km millisecond. C. 1500 ms. D. 1.540 mm SEC. The frequency closest to the lower limit of the ultrasound is A. 19.000 kHz. B. 10.000 MHz. C. 20.000 millisecond. D. 15.000 Hz. Which is not an acoustic variable? A. Density. B. Pressure. C. Distance. D. Intensity. The effects of soft tissue on the ultrasound are called A. Acoustic proliferation properties. B. Dynamic effects. C. Acoustic propagation properties. D. Biologic effects. All of the following are true except A. Two waves with identical frequencies must interfere constructively. B. Constructive interference is associated with in-phase waves. C. Out-of-phase waves interfere destructively. Is the time to complete one cycle? A. Pulse duration. B. Pulse period. C. Period. D. Duration period. Which of the following sound waves is ultrasonic and least useful in diagnostic imaging? A. 30 kHz. B. 8 MHz. C. 8.00 Hz. D. 3.00 kHz. What is the frequency of a wave with a 1 millisecond period? A. 10.00 Hz. B. 1 kHz. C. 1 kHz. D. 1 MHz. Is the distance covered by one cycle? A. Pulse length. B. Wavelength. C. Cycle distance. D. Cycle duration. Which of the following is determined by the source and the medium? A. Frequency. B. Period. C. Propagation speed. D. Range resolution. Propagation speed equals x wavelength. A. Pulse duration. B. Period. C. Number of cycles in the pulse. D. Frequency. As a result of the propagation speed increases. A. Increasing stiffness and increasing density. B. Increasing stiffness and increasing elasticity. C. Decreasing compressibility and decreasing density. D. Decreasing stiffness and decreasing density. A. Aperture that varies with transmit frequency. B. Aperture that decreases as a function of time. C. Aperture that increases with increasing focal length. D. Aperture that changes as a function of frame rate. To which acoustic variable is penetration depth inversely related? A. Frequency. B. Wavelength. C. Period. D. Propagation speed. Which imaging mode requires a broadband transducer? A. Continuous wave Doppler. B. Pulsed wave Doppler. C. Color flow imaging. D. Harmonic imaging. What is the Doppler shift frequency? A. Received ultrasound frequency multiplied by the transmitted ultrasound frequency. B. Difference between the transmitted ultrasound frequency and the received ultrasound frequency. C. Ratio of the transmitted ultrasound frequency to the received ultrasound frequency. What is the potential effect of increasing the pulse repetition frequency, PRF? A. Depth ambiguity. B. Decreased frame rate. C. Poor spatial resolution. D. Decreased penetration. What is the advantage of using pulsed wave Doppler compared to continuous wave Doppler? A. Higher echo sensitivity. B. Ability to select sample depth. C. Decreased display of aliasing. D. Improved temporal resolution. What affects the beam width in the near field? A. Pulse repetition frequency. B. Pulse duration. C. Frame rate. D. Transducer aperture. If the ultrasound machine comes in contact with a patient's body fluids, what should be done? A. Remove the machine from use for the day. B. Use an approved disinfectant solution to clean it. C. Call the manufacturer to see what they would do. Which ultrasound parameter directly affects an ultrasound beam's intensity? A. TGC. B. Operating frequency. C. Output power. D. Frame rate. The center frequency of a transducer depends primarily upon which characteristics of the crystal? A. Width. B. Length. C. Spacing. D. Thickness. Which factor limits the image frame rate? A. Transducer operating frequency. B. Sample volume size. C. Speed of sound in tissue. D. Spatial pulse length. When using a 5 MHz transducer, in which tissue is the ultrasound wavelength shortest? A. Fat. B. Blood. C. Bone. D. Muscle. Which term describes the averaging together of scan lines from multiple angles to create one image? A. Harmonic imaging. B. Real-time three-dimensional imaging. C. Elastography. D. Spatial compounding. Which variable can cause an acoustic shadow artifact? A. Small acoustic impedance mismatch. B. Refraction. C. Perpendicular incidence. D. Low attenuation. What does code excitation improve in addition to penetration? A. Lateral resolution. B. Signal-to-noise ratio. C. Frame rate. D. Dynamic range. How is lateral resolution determined for a pulsed echo system using a tissue-mimicking test object? A. By observing spaces between reflectors perpendicular to the beam. B. By observing spaces between reflectors along the beam path. Which control improves the effects of attenuation? A. Dynamic range. B. Pulse inversion. C. Multiple focal zones. D. Time gain compensation. Which Doppler angle to flow results in the greatest absolute Doppler shift? A. 0 degrees. B. 15 degrees. C. 45 degrees. D. 60 degrees. An increase in which parameter will improve the accuracy of velocity measurements with autocorrelation? A. Color field of view. B. Packet size. C. Wall filtering. D. Transmitted frequency. Which imaging modality can provide the most accurate measurement of tumor volume? A. Color Doppler. B. B mode. C. A mode. D. M mode. Which parameter is most likely to affect spatial resolution? A. Dynamic range. B. Beam width. C. System sensitivity. D. Depth of visualization. Which statement is most accurate regarding surface rendering three-dimensional ultrasound imaging? A. Improves accuracy of volume measurement. B. Minimize the effect of attenuation artifacts. C. Feature-based reconstruction stores the full three-dimensional volume acquired. What term describes blood flow changes in response to respiration? A. Phasic. B. Parabolic. C. Spontaneous. D. Pulsatile.